Hello, I'm Rachel McKenty, Director of Programs and Development at Legacy Education. Thank you for joining me for the CPB Practice Exam Review. Cases are one of the hardest portions of the CPB exam. I'll show you how I would tackle these. Let's review 5 cases. Our first case today is several pages. The first page appears to be demographics and other important information. We're going to skip this for now. The next page includes a HCFA 1500 form, also known as a HCFA, a CMS 1500, or simply a 1500, along with the case question. One rule of thumb on these longer cases is to always look at the question first, because before we even look at any of the other materials provided. This can save us time on test day by potentially eliminating materials unrelated to the question. The question in our first case is, what should be done to correct this claim from what is listed below? Instead of spending time reading each Roman numeral, a simple quick scan, and they all say correct or change, and the question also says correct, so let's give them a correction. Let's apply the process of elimination. Answers B and D share one of the options, as do C and D. I'm going to start with 5. Change the number of units for the visits. This could quickly, this could quickly eliminate 2 answers for us. Let's go close in on the units. Box 24G is the units of the HCFA 1500. We can see that 1 unit was billed for both services, which is correct. We can eliminate both B and D as an answer. Next, I'm going to look at 2, correct the modifier. Let's go close in on box 24D on the HCFA form. There are no modifiers submitted on this claim form. When a procedure code from the surgery section of CPT is submitted with an evaluation and management code, then the claim is required to have a 25 modifier, meaning that a modifier is missing and should be added to the claim form, making at least number 2 a correct answer. Knowing the number 2 must be part of the answer, we can eliminate A since 2 is not included, leaving us with only C as the correct answer. Here are Mary's demographic pages again. You may recall we skipped reading this on the last question. By skipping to the question first, we were able to see that we only needed to interact with the HCFA 1500 form, and we saved time by not reading this information. This will save you precious minutes during the exam. Sticking with this patient, let's look at another case. We are presented with the same demographic page and the same HCFA, but a new question. After the review of the case information provided and the completed claim, please select only from the choices given below on what you notice is in error on the claim. Note, you may see other errors, but only choose from the choices given. This is key in the note in this case. You may see other errors, but only choose from the choices given. Be mindful of that. Let's start by seeing which answers share value. A and C share number 9, and C and D share number 5. I would start with number 9. 9 focuses in on the diagnosis pointers. In this case, we can see 2 diagnoses, but only 1 pointed. A, D23.60 is pointed on both line items. Diagnosis B, J02.9, should be pointing at the office visit. While looking at these line items, I immediately noticed that the office visit is billed with a procedure without a modifier. Anything from the surgery section, which is the 10,000 through 60,000 series, when billed with an office visit, must include a modifier 25. Let's see if any of the options is a missing modifier. Number 8 is for missing modifier. Look at answer A, which we already have confirmed because it includes number 9, is the only possible answer. Case 3, Matt Smith. The first page is demographics and other important information. We're going to skip this for now. Another HCFA form with question. What should be done to correct this claim form from what is listed below? Let's skim the options. We have correct, 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 change. Okay, A through D. Notice that B and C share number 5. Also, C and D share number 1. Let's focus on number 5, change the number of units. This is in box 24G on the HCFA 1500 form. The code is an evaluation and management code. This code would not be allowed to be billed for more than 1 unit in any situation. Therefore, we know that we need to correct number 5. The answer is either B or C because it has number 5 in it, eliminating A and D. Going down the list, 3 is correct place of service. Place of service is box 24B on the HCFA 1500. The place of service listed is 23. To find the place of service, open your 2024 AMA CPT manual to the very first page. There is a list of all the numerical codes and their associated places of service, also known as POS. POS 23 is for the emergency room. We can see from the HCFA 1500 in box 32 that these services were performed at a primary care office, not an emergency room. The place of service would need to be corrected. Based on the POS codes in the beginning of the CPT manual, the correct POS is 11 for office. This makes B the correct answer. Case 4. The following claim is submitted. Which of the following describes the reasons for the denial? We see the HCFA prior to the answer options. A quick glance in my eyes immediately noticed that this is an E&M service billed with a surgical procedure, but there is no modifier present. We know from our coursework that when an office visit is billed in conjunction with a minor office procedure, we must affix the modifier 25 to the office visit. We know this is an issue, so when we look at the answer options, let's skip to D because my eyes see modifier 25 in its description, and this technique can help you save time on the exam. D, modifier 25 is not assigned to 99213. The answer is D. Let's review the other options to confirm our understanding. To and from dates are not required when only one date of service is listed. Place of service 22 can be used for 99213 as CPT description reads office and other outpatient services. An E&M service is allowed on the same day of service with the use of modifier 21, showing the E&M service is significant and separately identifiable. As previously noted, the modifier is missing on the claim form and would be the reason for the denial of the E&M service. Case 5. Based on the remittance advice and the payment policy provided, what action is required for the claim? A, the claim was paid correctly, post the payment and adjustment, send a statement to the patient if the coinsurance is not collected. B, the claim was paid correctly, post the payment and adjustment, write off the coinsurance amount because the balance is so small. C, the claim did not pay correctly, both services should have been paid at 100%. Contact the payer to reprocess the claim for full payment, or D, the claim did not pay correctly, the E&M service should be paid at 100% and the surgical procedure should be discounted. File an appeal. The first two options state that this was paid correctly and the other two that it was incorrectly. This could be helpful when using the process of elimination. Let's review the accompanying documentation. First, we see our remittance advice, also known as an RA. When these come in electronically, they're known as ERAs for electronic remittance advice. This is a standard explanation of payment, or EOP, that the provider uses to post against the patient account and send out patient balance statements accordingly. Next, we see the payment policy regarding significant, separately identifiable E&M with Global Day services on the same day. The policy reads, policy applies to all professional services performed in an office place of service. When a significant, separately identifiable E&M service, append with modifier 25, and any services that has a global period indicator as designated by CMS of 0, 10, 90, or YYY performed on the same day. The E&M service will be reimbursed at 50% of the contractual amount. When performed in a facility, both services are paid at 100%. Reviewing the remittance advice, the first listed procedure is 99232. This E&M is used when the place of service is inpatient or observation. Since this procedure code is telling us that this is used for a facility, we can refer to the payment policy, which notes that facilities are paid at 100%. This claim is therefore paid incorrectly, and both services should have been paid at 100%. The answer is C. The claim did not pay correctly. Both services should have paid at 100%, and we need to contact the payer to reprocess the claim for full payment. Thank you for joining us. For more CPP practice exam questions, please visit our website at medicalbillco.com.